Jasmin Perdomo. Welcome to the Tick Bootcamp podcast.
I'm excited to be here.
So Jasmin, before we get into your story, can you tell us about this book you're going to be publishing that has all of this beautiful poetry in it, some of which is about Lyme disease?
Yes, the name of the book is Bittersweet Body, and it's a poetry collection that I put together basically the last 7 years when I started writing poetry again and I was bedridden. So I would say it's a raw and real poetry collection. And there was a time when I prescribed, as I say, poetry to myself when nothing else was working. And I would also paint in bed because there was nothing else to do.
So I'm going to put you on the spot a little bit, Jasmin. Can you give us a little something from the book? Give us a little teaser.
Like a poem?
Yeah.
Oh, wow. Okay. We're getting right into that. Let's see. I have something here, short and basically what poetry does for me, what it means to me. When I say poetry saved my life, I mean it gave me mouth-to-mouth resuscitation when I couldn't breathe. I mean poetry led me to an operating table and performed open heart surgery. I mean poetry stitched up my wounds when I was bleeding internally. I mean, poetry came to my defense when life made no sense. I mean, poetry is my lifeline when things don't align. I mean, when I lost my voice, poetry gave me a choice. I mean, I can trust poetry because poetry claimed me.
Wow, that is very powerful. So Jasmin, before we get into your Lyme experience and when poetry became the tool for you to heal and get through some of the difficult times in your journey, we got to go all the way back to what young Jasmin is like. And Rich is going to walk you through this. So can you start by telling us what was young Jasmin like and what your childhood was like?
Hyper, athletic. I played basketball, ran track and field, volleyball, any sport, give it to me, challenging, and that competitive. So I would say that was me.
So physically, where was it? Where were you growing up while you were the hyper athletic, hyper energy young Jasmin?
New Jersey.
And
so
where
I was
in Jersey?
born in Newark.
Okay.
Raised in Elizabeth, New Jersey.
Okay. So you're part of the Lyme Belt. You grew up in the tri-state area, and we're always bouncing back and forth between whether or not New York has the greatest number of Lyme disease diagnoses, or New Jersey does, or Pennsylvania. And fortunately for us, I guess that Pennsylvania has the largest number right now, but you were in the Lyme Belt.
Pencilin. I went to college in Pennsylvania.
Okay. So there we go. So you went from bad to worse, from the frying pan into the fire when you went to college. So as a child in Pennsylvania who had all of this energy and were pursuing all this athletic enrichment, what do you know about Lyme disease?
Absolutely nothing. I heard it by one of my friends at the time in college, and she had mentioned it. Oh, I had Lyme disease. I got a round of antibiotics, and she was fine. So again, no questions asked. It was mentioned. It was the first and only time I've ever heard the word Lyme disease.
Okay. So all through your educational experience and all through any training you received as an athlete, and we want to learn more about your athletic pursuits, so I'm assuming some of them were outdoor sports, you were never given any tools to protect yourself from Lyme disease?
No.
Okay. So tell us when you first started to feel sick.
At the time, I was in Puerto Rico. I was working at a hotel, and first symptom I would say was fatigue. I couldn't get out of bed. I was late all the time. That was first. Second was heart palpitations. But we're not talking regular heart palpitations. There was a point I was in the office and my heart started beating so fast, I thought I was having a heart attack. I ran to my boss's office and said, I think I'm having a heart attack. I'm going to drive myself to the hospital. I ran from her office.
How old were you?
I was in my early, I would say like maybe 26, 27, late 20s. And I drove myself to the hospital, went right into the receptionist and told them, I think I'm having a heart attack. And quickly they took my the beats per minute, and it was 164. So I was hospitalized for about a week and a half, and they didn't understand why my heart was going so fast. Giving me injections, beta blockers to bring the heart rate down. Finally, it levels out. And from then on, that was, I would say, the first journey of not knowing what I had and seeing a cardiologist. So that was step 2.
Okay,
there.
so gal who grew up in New Jersey,
Yes.
goes to school in Pennsylvania. How do you find yourself in Puerto Rico?
My ex-husband.
Okay, so you were married at the time. You and your
I was married at the time to my college sweetheart.
okay.
I was married about almost 14 years, I would say. We were together.
Okay, you don't have to whisper that. It's okay. You have an ex-husband. And so you and your college sweetheart moved to Puerto Rico. You
That's
get a
correct.
job working at a hotel.
Correct.
And while you're working at the hotel, you have this health crisis, right?
Correct.
I mean, and did you have any indication before you had the health crisis that sent you to a week-and-a-half stay in a hospital that your health was beginning to fail?
Besides the noticeable fatigue, no.
When did the fatigue start?
I would say maybe 6 months prior to that, maybe a little more.
So when the fatigue started, were you still in Pennsylvania? Were you in New Jersey? Were you
I was
Puerto
in
Rico?
Puerto Rico.
Okay. So
It happened, I would say, not too long after I had moved there.
okay. So if you were to guess, do you think you were bitten by tick or ticks during the course of your childhood, just being an outdoorsy kid? Do you think you were bitten by ticks in Pennsylvania? Do you think perhaps you were bitten by a tick in Puerto Rico? What is your sense as you have some time to reflect on this?
I've removed 2 off of my body.
All right, so share that with us.
Yes. So one in Puerto Rico while I was living there, but prior to that, there was also one in Pennsylvania. So yes, while I was in college, because I mean, it's beautiful, it's green, and it was a normal spring, summer days, we'd sit on the grass.
Okay.
Yeah.
So you had these two different tick bites that you're aware of. Most of us have been by ticks many times that we're not aware of, but at least on 2 occasions you were bitten by ticks. Did you take any steps after the tick bites that you had to help your immune system manage or deal with all the bugs that were spit into you after you pulled the tick off?
Absolutely not. I just grabbed a tweezer, removed it, flushed it.
Okay. No, didn't reach out to any doctors, didn't have the tick tested, you didn't do anything like that?
Nothing.
Okay. So now generally what we see in the Lyme community is that you may or may not have an acute presentation with Lyme disease, but if you ultimately have a chronic presentation, which you had beginning in your time in Puerto Rico, it's because there's been some immunosuppressive event. So what was going on in your life, either at work or at home, or a combination of your personal experiences or professional experiences that do you think caused you to be immunosuppressed and then caused this disease to take off and become a chronic illness?
So I wouldn't say I could pinpoint it, but knowing what I know now and what I didn't know back then is Puerto Rico is very humid, moldy. So that's a possibility, right? Being exposed to mold. And I would say high stress because my job, I mean, working in the hospitality industry, sometimes doing double shifts, it was a stressful job. But then again, I thought I could handle it. I thought I was young. I was used to that high. It was fine. But at one point, it wasn't.
If you weren't harboring all those bugs, you probably could have managed it all. But, burning the candle at both ends is not something that is healthy for someone who is trying to manage a disease, right? So anything going on in your personal life at that time, in addition to all the hours you were working, living in a place where you hadn't lived before, right? You're a native Jersey gal, and you're now living in another place. And you did share with us you did go through a divorce. So what was else going on in that
I
arena?
would say the divorce definitely was very hard. Having all those symptoms and not understanding or knowing, because in Puerto Rico it isn't common to be seen by a doctor for Lyme disease. So at that time, yes, it was a very, very, very rough, dark moment going through that divorce. And I would say that's what...
But where was the divorce? Was the divorce happening at the time that you had the crash and you had your week and a half, or did that happen afterwards? And
divorce was after.
Okay.
So symptoms were prior, and we were still together for a couple years before the divorce.
Okay.
But
So fatigue,
Yes.
The crash.
Yes.
Hospital stay.
Yes.
Divorces a couple of years later.
Yes.
All right.
Correct.
So how did your health journey develop after the hospital stay?
After that, vertigo, not being able to walk straight. I completely lost balance, holding onto walls side to side to get to work. High ringing ear, TMJ. I had the one side of my face, like the facial paralysis situation, heavy tongue, slurred speech, and memory situation. It was horrific. Like, I literally remember driving to the supermarket and I couldn't get back home. I knew where I was, and I remember being behind a wheel and saying, I know, like, I knew where I was, but I did not know how to get back home. That was freaky. And I would say that was beginning stages.
Okay.
Yes.
So how long did your Lyme disease journey take place before you were diagnosed? And where did you get your diagnosis? 4
years.
Okay. And were you living in Puerto Rico during that time?
I was. I've seen so many doctors in Puerto Rico, of course, because everyone didn't understand why taking multiple drugs, as Matt had mentioned, like anything I was thrown, I'd take it. Because at the time I didn't understand, right? And again, you trust the doctor to help, per se, as well. And yeah, that was.
So you moved to Puerto Rico after college with your husband. You live with him for about 2 years. Then you go through a divorce, and then you stay in Puerto Rico even after the divorce.
I did. So I went about 4 years undiagnosed, right? While I also, by the way, before finding out I had Lyme, I would say one of the craziest things I did was a water fast. So I did a water fast for about 14 days.
What is a water fast?
Drinking water.
Nothing else.
Absolutely nothing else. I had no solids, no anything, and I changed my diet. I was like that perfect patient, by the way. Even though the doctor would give me the pills and all of that, I would also do research. I would also read, which made a lot of the things confusing, right? Because someone's telling me one thing, but I'm not trusting 100% because what's being given to me isn't helping me. So obviously there's something wrong there. What I'm being prescribed, so why am I not feeling better? So that's when I actually explored the whole holistic approach, because I didn't know about that either, to be honest. So I would go to naturopaths and tell them my symptoms, and then they'd give me the herbs and everything. So I was at one point doing the whatever the doctors were giving me, plus I had the naturopath, and I put them together, and I started basically there when it came to that. And then towards the ending, I would say that's when I did the water fast for 14 days, and I was about 84 pounds. There was one point that I could not get out of bed. I would, from the mattress, I'd literally physically like kind of swoop off the mattress. I'd crawl to the bathroom to use the bathroom, go back on the floor, and crawl back to my bed to get on the bed. So mobile-wise, I was done. 84 pounds, I couldn't walk. The walls were my canes, and that's basically how bad it had gotten before I came to New York.
Okay, so let's build that out. So who were you living with between the time that you divorced and the time that you came back to New York?
By myself.
And were you able to work? And if you were, where were you working?
So, true story, I lost my job because I'm not sure if you've heard of the Hurricane Maria that hit Puerto Rico.
Yes.
Lost my job during that point. In a matter of 3 months, also got a divorce and lost my health. So the whole mobility situation I had that I was saying that I went from the mattress to the bathroom and I was crawling, all that within 3 months happened. So again, I would, and I do say this a lot, my mother was an independent mom. I'm not one to complain. I've seen a strong women in my family. So in a way, I felt as though I can handle it, right? I wasn't one to really ask for help. I was one to, what do you need? Help people. But again, I didn't ask for it, right? So I handle a lot of that. And before my family even knew I wasn't feeling well, it was years after.
Okay, so let's talk a little bit about relationships, and healthy relationships versus unhealthy relationships, right? So as a Hispanic person, you come from a warm, supportive family, right? I mean, that's just the nature of the culture, very much like the culture I come from, and we're taught to love, but not how to receive love. So talk to us about either the cultural environment you found yourself in during your childhood, or the way that you were parented. Why were you able to be loving but not receive love?
I would say because of the women who raised me. I was raised by my mother, my grandmother, and my aunt. There's a lot of tough love, and I would say that's where I got the I'm fighting back part. And then there's the grandmother love. And I have them both. So the giving end is 100% my grandmother. I mean, she gave love. And I got that from her, I would say, right? And it's like loving, loving, loving. And then it's also the tough love. But I give myself the tough love. I give others the grandma love.
All right, so let's talk about relationships, and there are three different ways that we can be in relationships. We can be out of relationships, meaning we can be independent of relationships, and we're going to just rely on ourselves. We can be dependent, meaning we're essentially, in some ways, parasitical, and we're just allowing other people to love us, but we are not giving any love to them. We're not serving them. We're just allowing them to serve us. And then, of course, there's interdependent relationships, which is really the only true healthy relationship you can have, where you're receiving love and you're giving love to the people that you're in relationships with. One of the things that we've observed during the course of interviewing the hundreds of people that we've interviewed on this podcast is that either people didn't understand how to be in healthy relationships, and that made their Lyme disease journey accelerate because they couldn't receive the support and the love they need in order to be able to be healthy. Or even if they understood how to define relationships in a healthy way, meaning that they're truly interdependent, they lose the ability to receive love, and that also accelerates their ability to heal. So talk to us about relationships, how you were raised in the context of the culture you were raised in, and how that either put you in a position where you couldn't receive the support you needed so that you could reduce the length of your healing journey, or how you lost the ability to define relationships in a healthy, interdependent way. And as a result of that, it accelerated, or actually say it extended your sickness.
Yeah, I would say the tough love part, and it didn't help. The way I was loving myself, right? So there is a cultural part, very warm, very loving and loud, and that's just part of, right, being Hispanic. But there's also the other end. I would say that it is cultural to be strong and not to seek a therapist. I mean, the truth is, I'm probably the first generation in my family that has seen a therapist, right? Prior to that, you don't hear of that. You don't hear of the word depression. You don't hear of the word anxiety, right? And since it wasn't a norm growing up to seek therapy or those other two words that I mentioned, so I guess the whole survival mode or not expressing, because of course what we don't express, we suppress, and it becomes depression, right?
So certainly can be, but what I'm focusing on now, what you just shared with us in the journey is you're living in Puerto Rico by yourself 2 years after you're divorced. Right? I mean, you're by yourself, right? Yes. And you have all of these supportive women that you could have come back to in the tri-state area who would have been supportive of you, but you did not do that.
I ended up doing that eventually.
Well, 2 years later.
Almost.
And you were getting sicker, and you were getting sicker. I mean, you're getting to the point where you're describing the wall as your cane. I mean, you're being poured out of your bed onto the floor so you can crawl to the bathroom, right? I mean, again, we've heard these stories many times. Matt is certainly going to connect with you on that, where he was peeing in a cup and his parents had to, put it in the toilet for him. He was so sick, right? I mean, that's how bad it is. But you allow your disease to accelerate and you get sicker and sicker and sicker. Even you had these people who would love you up and help you. Why? How did you define relationships in a way that allowed that to take place?
I would just say being strong. To me, that was what strong is. To me, if I did that, and saying to myself, I can handle it. I got this, right? Because you got this. That's what I thought at the moment.
And that's how you define relationships.
Probably more of the giver than the...
Because if you're receiving care and you're receiving love, you're weak, right?
100%, Rich.
And you're not going to be weak, even though it was causing you to get weaker and
Correct.
weaker and weaker.
100% agree.
So let's Matt's going to take you through the journey of your interaction with doctors after your diagnosis. But I do want to focus on your relationship with doctors for a moment before Matt talks to you about that, right? Because clearly you didn't have a healthy definition of relationships, even with all these really supportive women, mother, grandmother, aunt, who loved you to death, who gave you everything that you needed, who would die for you. You couldn't accept love from them when you were at your worst, right? So when we have these unhealthy definitions of relationship rather than to be interdependent, we bring that to our interaction with our doctors, right? And we don't recognize that our relationship with our doctors should be healthy and interdependent, where we're serving them and understanding empathetically where they're coming from and their limitations, and we are accepting service from them, but within the reasonable parameters of any healthy relationship. How did your unhealthy definition of relationship, which caused you to have this acceleration of your illness, drive your relationships with doctors, or set the prism in place for your relationship with your doctors?
Can I challenge you on that?
Please.
I believe they're separate in a way, because I saw doctors as, you're my help, this is what you studied, or, right, you went to medical school, so I trusted. This was the first time I really got sick, too. I really didn't go to doctors prior to that. So this was also new to me, this doctor-patient relationship. So it was like automatically, they're going to help me. That's how I saw them. So I trusted a lot of them, and until that trust just went out the window.
And how did the trust go out the window? Why did the trust go out the window?
Not listening. Being quick to give me a prescription when I'm saying, and again, I had to learn how to listen to my body and actually say, you're wrong. And not say it, just not go back. But that took me time because I trusted, right? And even when these medications weren't helping me, and I would express that, it's not enough time. It's not enough time. But again, more symptoms were coming up and adding on. And there was something, it was my intuition, my soul, it was God, it was everything. This is not your diagnosis. This is not, I was misdiagnosed. It's because of scoliosis. It's because you have an ear situation. That's why you have vertigo. Oh, you might have something in your heart, and that's why it's that. So every new symptom was another specialist that I was trusting, and I was expressing, hey, this is not working. Hey, this medication is not working. It didn't matter. And there was something you had mentioned prior on this podcast that I've heard before. If the doctor doesn't know, then move the patient on, or maybe be honest. I've experienced a lot of ego because I am not a patient that's just, I'm going to ask questions. I want to understand why you came to that conclusion. Right? So yes, I'm going to take what you're giving me, but also if I'm the patient and I'm interested, I'm concerned about my own health, and I'm asking questions, why not explain it and answer? And I would get cut off. That is where the doctor-patient situation started going apart, when I noticed the dynamic, and then a lot of them being out of pocket, right? And once it gets out of pocket, Now you're charging me a lot of money, and I'm basically working for my health now at this point, and I'm still not getting better. But you're telling me to continue doing the same exact thing that I'm doing, and I am telling you, I am not feeling better. I'm actually feeling worse. So why not stop and actually analyze, is this why continue paying, continue putting, I'm on the same exact, it's to the point that how can I trust?
Okay, so let's explore that, right? Because one of the things that we focus on here at Tick Boot Camp is relationship, right? Our relationship with ourselves. We're going to explore that a little bit, you and I. Our relationship with the people in our families or our social support, and then our relationship with our doctors. In most cases, we don't have a healthy relationship with ourselves because we're socialized not to have a relationship with ourselves. We don't even understand that we're a spiritual being, we're an emotional being, and we're a physical being, and that the totality of the signals that we receive from our spirit, from our emotions, and from our physical body in most cases are being ignored. And we're not being socialized and educated to be in touch with those so that we can allow our onboard diagnostic system to become a part of how we make our decisions and certainly a part of how we interact with our doctors. We also see that there are unhealthy relationships between us and people in our social circles, meaning in many cases we're just giving love without receiving love, and in some cases we're expecting love without returning love, right? And it isn't independent. And then of course our relationship with our doctors and how those relationships aren't always healthy, right? And one of the things that we see with folks who ultimately develop a healthy relationship with their doctors is not only are they willing to receive love, but they're also empathetic to the doctors that they're working with. And they understand the limitations that their doctors have educationally and temporally because they only have 15 minutes with us, and financially, and like we understand their limits so we don't have unreasonable expectations about what we can get from them, right? But the people who do the best are the people who understand they have a healthy relationship with themselves. They write it down, and then they bring that to their doctor. So talk to us about, Matt had you share a poem as, early on in this podcast, and I want to talk a little bit about your background as a poet. Were you using those tools? Were you consistently writing down how you were feeling? Were you looking to have a history of how your health was declining and how you were feeling and what signals you were getting from your body? And were you bringing that to your doctors as well, or were you just sort of getting sicker and sicker and sicker, knowing you're not feeling well, interacting with doctors and getting frustrated because of the challenges that the limitations of the relationship brought to you? Give us that piece.
From the beginning, I had a timeline.
Okay.
And I still have it. And not month, but year and symptom. And I actually uploaded a plain body, and I have it pinpointed. So the heart, I don't remember, I think it was 2014, 2015. I have right there 2014. And now that I know, I would say like Lyme carditis or whatnot, but I would say heart palpitations, right? And tachycardia. So I have that, and I still have it. Vertigo right after 6 months. Everything is pinpoint perfectly. So when I actually go to a doctor, that's the first thing they see. So you can see the journey and where did it start and where it's at now.
So you were able to show the migrating symptoms.
Absolutely.
But in the macro, this year, 6 months later, a year later. But I'm asking more specifically. Like every day, I felt scared today. I feel nauseous today. I feel anxious today. I feel like every day. And as you're trying another medication or you're trying another treatment protocol, yes. Are you identifying how you feel and how all of these little symptoms are progressing or not progressing?
In the beginning, I had a journal. Okay. And actually, no, it wasn't. It was a calendar, planner, sorry. And that's where I would put everything, even to the point of what I ate that day. Okay. That was during the beginning stages, absolutely, because I even wanted to know.
And were you using that to give your doctors a general outline of how things were digressing and how things were not going the way you and he or she were expecting them to go when you were given new medications and new treatment protocols?
100%.
Okay. So now let's go back to the poetry piece, right? When in your childhood or during your early life did you begin to write, and how did it serve you during your pre-illness life?
I would say 12 years old, the first time I heard Maya Angelou.
Okay. And how did Maya Angelou and you hearing her inspire you to use that as a part of your life's journey?
During that time, I would write poetry and just loved writing. And for a long time, I stopped.
When did it start and when did it stop?
I would say it stopped in college because life gets serious and, you're free in a way, right?
You got to spend time with the boys. And...
Yeah, exactly. I already had met my ex-husband, so writing stopped. And so that was then. And then it started again when I was bedridden.
Okay, so let's pause there. When did you receive your Lyme disease diagnosis? Because Matt's going to take you on that portion of the journey.
I believe it was 2018.
Okay.
Yeah.
So, Jasmin, before we talk about the diagnosis and what that was like, I do want to follow up on some of the pre-diagnosis components you discussed with Rich. Mm-hmm. So specifically, Jasmin, you mentioned you were doing some pharmaceuticals from doctors pre-diagnosis and alternatives as well.
Correct.
Do you remember the specifics you can share with us, what you were doing?
Acupuncture, herbs, chiropractor, exercising, a lot of stretching, like physical, just because it affected me stiff. I was, and I'm still very stiff, right? So I would say those, from what I can remember, and also seeing the naturopath. So I was on the natural, I was on the chemical stuff, plus all these other tools I added to that, which was the acupuncture, the exercising, the chiropractor, therapy, because I also, it affected me mentally as well and emotionally. So I added therapy. So at one point, I had so many appointments, so many doctors, and that was my toolkit. Like at an early stage with this, I was like making my own toolbox, organizing. Hey, okay, this isn't working. Oh, I read about this. I'm going to go try acupuncture and cupping, all of it.
Yeah.
And I also, being that I was an athlete, I couldn't be in a bed. I mean, personality-wise, I have a hyperactive personality. So being restrained to that bed, that hit me like a ton of bricks. That's why I needed to let that energy out somehow. And that's when paper and pen came back. And that was my exercise, because what else was I going to do?
Yes, I'm trying to figure out where these things fit. So Rich and I have come up with a framework for healing. Mm-hmm. It's called PARM. Mm-hmm. So P is for prehab, which is kind of what you're describing, even though you never diagnosed some of it. And I want to discuss that further. Then you have your assist, which is more of the antimicrobial side, assist your immune system in eradicating the pathogens. Then you have your R, which is your rehabilitate, kind of rebuild your body. Mm-hmm. And then your M, which is your maintenance, the things you do every day for the rest of your life to stay healthy and not have a relapse. So although you didn't have an official diagnosis, a lot of the tools you described are good prehab tools. So can you share with our listeners what tools you did at that time were actually helpful for you and would be a good prehab tool for our listeners to use?
I would say to find your thing. And again, when I was sick, you have, or again, I don't even like the word, to be honest, to label it as sick. But again, we were meant to heal. That's how I see it. And being in bed, you have a lot
of...
Unwell.
Right.
Thank you.
Temporarily unwell.
So being in bed, you have a lot of time to think, right? So besides the physical, the other gunk started coming out, meaning the emotional part.
Yep.
Meaning the divorce situation I had gone through, meaning maybe some childhood trauma here or there starts coming up, right? Because now you're alone with your thoughts. And that's where poetry helped as well, getting that stuff out. And that's when I actually can say, I realized the physical and the emotional come together. Yep. They really do. And I would also say that my faith, personally, right? Everyone's different, but it saved my life. having the relationship that I have with God, praying every day, knowing that our bodies weren't meant to be sick. And I have to keep reminding myself that every day, right? We were created in a perfect image. We weren't created to be sick. And again, I just have to keep reminding myself that.
So, Ted, let me give you a little bit more of a context, right? So when we talk about prehabilitate, we're first talking about recognizing that we're a spiritual, emotional, and physical being, right? So we have to be in touch with our essence of being physical, emotional, and spiritual. And also the things that you're beginning to do with movement, with food, with detoxing, generally means pooping and peeing, just making sure that, you're taking those steps to get your body ready for ultimately this battle. And so the physical piece is how are you feeling physically and what were you doing physically? Emotionally, understanding that we have this binary brain where we're going to be in fight or flight or we're going to be in rest and digest. And spiritually recognizing that not only are we made to be in connection with God and to be in connection with spirit, but also we're made to serve, right? And that we need to understand that that's a vital part of who we need to be spiritually healthy. So when Matt is talking about the prehab, he's asking you, what are the things that you were doing physically? What are the things that you were doing emotionally? What are the things that you were doing spiritually? And how did that come together to prepare you for what you needed to be prepared for so you can go and help your immune system both kill the bugs and ultimately detox all the things that were being killed in your body?
So I think it's a little bit of, I would say, like a hard question just because I'm not feeling well at the moment.
Okay.
At the time, I was taking a heck of a ton of antibiotics, and I was detoxing. So that was life.
Jasmin, this was pre-diagnosis?
This was after diagnosis.
After. Okay. So I'm going to pause you there real quick to go back to pre-diagnosis.
Back to pre-diagnosis?
Yes, because I think there's still some things there that were extremely powerful.
Okay.
And I wish I had, and I think a lot of our listeners wish they had as well. So specifically, you said your faith. So prayer and your relationship with God helped you.
100%.
And that strengthened your immune system because it took you out of fight or flight. And that's a critical step to prepare your body to heal.
Got it.
You also mentioned that your creative outlet. For you, it happened to be, your poetry. For others, it might be something else, right? It might be singing. It might be writing. It might be journaling. But those are all things that help people as an outlet. And it's as simple as it sounds. Those are prehab tools in your tool belt to get you ready for treatment, right? So you were getting ahead of it. You had all these doctors. They didn't know what was wrong with you, but you were on your own finding tools to help you get ready for the treatment once you got properly diagnosed. So I also think you mentioned that your chiropractic care and your acupuncture.
Correct.
We know that a lot of these toxins and a lot of these, die-off of pathogens get stuck in our body. So I think a lot of the manual push and stimulation of your joints and of your skin helped your lymphatic system move to help you be able to run more efficiently as well. So I think those are great tools as well for people.
Correct.
And we take them for granted. They're simple things. Some of them are free, some of them are low cost, right? And I think those are the kind of things we're looking for. So before we get into your diagnosis forward, is there anything else that you did that you think was a good tool that is a broad tool for people listening to this podcast that they can put into their toolbox?
I'm going to add to that, actually, what you said. That helped me more than anything else. The poetry helped me more. My faith is helping me more than any doctor, any prescription can help me. So not losing a sense of self when you can't control the circumstances.
Yeah.
It was like, how can I connect with myself when my body has become a stranger? Right? I don't know who this is right now. I don't physically, like, what's going on with me. No answers at the moment, but who am I? I need to remember her. I don't want to let her go. So for me, again, and I think it's, again, the athletic person in me, the competitive nature, it's, okay, I'm in bed right now, but what am I going to do in bed?
Right.
Because I've given myself the pity party. You have a right to it. Personally, I believe you do. We go through a heck of a lot of pain. We go through a lot of confusion with the whole thing, right? But when you can't control your circumstance, what can you control? And at the moment, for me, to protect myself from what was going on with me physically, I had to connect with little Jasmin. I call her. And little Jasmin loved to write.
Right.
She loved art. She loved to paint. And in bed, I had no control. No pill was helping. Everything I was doing, thousands and thousands of dollars I was spending with all those appointments everywhere. I had a calendar, 2 p.m. here, Wednesday, 6 p.m. here, everywhere. And I would say, number one, what's your thing to get you, what do you have control of? Connect with that.
Right. But I do think that there's pros and cons. So what I'm taking away from that statement is you had this, even when you were really sick and bedbound, you kept saying, what should I be doing? What can I do? And I think there's a double-edged sword there. So the first part of it is, yes, you should continue to go to doctors to get to the root cause to figure out what's going on so you can take progress forward. And I think that's a healthy way to approach that. But speaking from experience and how I am, and I think we're a lot of like in this regard, Jasmin, is I also think that when you needed time to heal, you wouldn't just give yourself the grace to rest and let your body heal. You were thinking, I need to be more, I need to be productive, and I feel like I'm a failure, and I have to be earning and proving my love and proving my worth. And that's something that I kind of went through myself. So I'm curious if you think that that is something similar you shared in your journey.
100%. And I'm smiling because that's 100%.
So now in the pre-diagnosis stage, I think that served you well because it got you to a place where you finally found a doctor and you got a diagnosis. So walk us through that. You're in Puerto Rico. How the heck do you find a doctor who understands Lyme disease, and how do you get the diagnosis?
I didn't find a doctor in Puerto Rico that
Oh,
yeah.
okay.
What ended up happening is that I got so sick that I, again, barely could walk. Again, financial situation going on there, that my mother, my aunt, and my grandmother flew into Puerto Rico because, as my grandmother would say, I'm sensing something's wrong with her and she's not saying anything. So it was her. And in a matter of days, I had 3 women in my house. And when they saw my condition, it was like, what's going on?
They kidnapped you and brought you back to New York, or to the tri-state area, I should say.
100%. And the thing is, when I first actually thought of the whole Lyme disease situation, it was my mom. She knew someone that had a daughter with Lyme disease. And in a casual conversation, she brought me up and they tell my mother, hold on, that sounds just like my daughter. Those are all the symptoms my daughter has. Your daughter should get tested for Lyme disease. So when my mom and my grandmother and my aunt go to Puerto Rico and they see that condition, the first thing my mom said was, we need to get you tested for Lyme disease because I was talking to this person and it's all the symptoms you have, Jasmin. So we're going back, and this is the doctor she saw, because she ended up calling her and saying, who did you see that diagnosed you, right? So we end up flying back to New York. Saw the doctor. I sat in his chair. No blood work, no nothing. Everything I'm explaining to you. This is what happened. This is what I ate. This is this year. All the blood work from back then. And he said, I don't even need the blood work to know you have Lyme disease. Now I'm going to test you to see which one, what tick-borne illness you have, what bugs you have. And I said, okay, well, first time I heard a name, like an official diagnosis. So, of course, you get really excited. Yep. I mean, I left that doctor's office and I wanted to walk home from New York, and I live in Jersey. That's how excited I was. It was like, okay, there's an answer, which means I'm going to get better. That's it. Like, this was hope right here. I didn't know what that looked like forward. I just got that diagnosis name. The excitement came after that. And of course, I didn't know where Lyme disease was back then. We're talking now, I'm 12 years going on. And what we know now about Lyme disease is not the way it was back then.
Nor was the testing, even though the testing today is god-awful, it was even worse 12 years ago. So when your doctor ran the blood test for Lyme disease, what came back? Were you positive for Lyme or any co-infections?
Bartonella, Babesia. There we go.
So you were one of the lucky ones to have Lyme, Barton, Babesia as official diagnosis.
It came out flying colors. He did, no doubt.
So now that you have the positive blood work to back up the clinical diagnosis, and you go back to this doctor in New York, is he telling you now what you're in for? Is he giving you the reality of what's ahead of you?
Not really. It was quick protocol antibiotics. That's it.
What kind of antibiotics, and were they oral or IV?
Oral. And supposedly it was better than the IV. So we have the clarithromycin, the doxycycline, azithromycin.
The combination therapy, the standard combination.
Lost count of all the antibiotics that I've taken.
How long?
Rifampin.
How long were you on that for initially?
Years.
Multiple years.
Yes, on and off, because I would get a lot of gut issues. So it was on and off antibiotics, years and years of antibiotics. So it was, I would feel a little better, have a couple months. Great, this is over with. No more Lyme. Lyme's behind me. I'm moving forward. And then 5-6 months would pass, down. But it would be worse than...
Yep.
And it just became a complete cycle.
Yeah.
Every year was half a year on antibiotics, the other half...
Getting worse.
Exactly.
Yep. So I want you to respond to something, Jasmin. Rich and I went to a Lyme conference early on in Tick Boot Camp to try to learn. And the person running the conference, as well as the patients that were there, at the end, we ended up having a little chat. And they were asking about my experience with Lyme disease. And I told them my personal experience was I had a PICC line in for, it was 4 weeks of IV antibiotics. And I did a lot of other things since then. And all of them, the facilitator of the conversation and all the patients, were, Rich can elaborate if he disagrees, but I felt they were kind of pressuring and bullying me into long-term antibiotic use.
For sure.
They were telling me, you will not get better unless you do long-term, multi-year antibiotics to kill the bacteria, and you're wasting your time. You'll learn, basically saying you're stupid, you got to do long-term antibiotics. Now, I started to question, like, oh, I'm not really where I want to be, but maybe that's the answer. And I started to question my approach. But I'm curious now where you are, and now I'm in a much different place as well. What is your response to that situation?
Did you say multi-year
Yep.
antibiotics?
Yep.
I took Rezephin IV 7 days a week for 2.5 months straight after taking the oral. So I was on oral antibiotics for a long time when I kept saying I'm not getting better. I'm actually feeling worse with the whole detox and all the, what is it when they go from one antibiotic?
Yep.
Thank you. The pulsing of it. Then it was like, no, now we got to hit you with the IV and now Rezephin.
Yeah.
Okay, no problem. Here you go. Anything to get better, right? I didn't get better.
But one of the things that Matt was asking you is from a prehabilitation standpoint. And
Yeah.
one of the things that Matt has observed with many of our past guests is that even before they have a diagnosis, their spirit or their emotions or their body's starting to speak to them, and they're starting to take steps to go through a prehabilitation process, even though that's not really what they're focusing on, right? And one of the criticisms we have of doctors in many cases when they have a new Lyme patient is they don't get you ready for the battle, right? And antibiotics is an important part for many people in that journey. We're certainly not anti-antibiotic, but these doctors are really quick to get you on the kill phase that they call it. We call it the assist phase, but they don't help you to go through a process of shoring up your immune system and getting your detox pathways open and getting you in a place where you can deal with all of the challenges that come along with the benefits of antibiotics. So was there anything like that where the doctor said to you, hey, Jasmin, you have to start moving because movement will help you with detox? Hey, Jasmin, you need to make sure that your diet is really, really super clean, and you're not bringing any toxins in, from your food. Hey, Jasmin, what is your prayer life like, and what is your service life like, and are you doing the things that light you up the way God made you, whether it be poetry in your case, and we're going to explore it together. Were you getting any of that, pooping, peeing, sweating, moving, eating, sleeping? What's your sleep like? I mean, was all of that in place before you're taking all these antibiotics, or it was like, let's go, let's just,
Yeah.
It was let's go, and I knew about detox before. The doctor never mentioned detox. The as you mentioned, when I was in Puerto Rico and things I had read up on, is that I knew that. I didn't even, after that, I found out about binders like years later when I had already been years on antibiotics. I found out about probiotics years after my gut was wrecked and I was on a liquid diet for a long time. Just smoothies, because at one point,
Couldn't eat.
couldn't eat, right? So if that, it's perfectly said, because this is a journey and it looks different for everyone. But we know, I would say now, what we may be up against, right? So that prep, that toolkit,
Yeah, the prehab toolkit that we're
the
describing.
emotional
Yep.
part, the spiritual part. Wow. I mean, I didn't even know that I was doing what I was doing until you're mentioning that now. That was just my way of, what am I going to do here?
And that was your intuition. You did that on your own, right? And to stress the importance and the reason why I'm asking these questions and why Rich is building on them is we have found so many people come on this podcast and so many people share with us privately that they jump into either aggressive combination antibiotic therapy or aggressive IV therapy as soon as they get a diagnosis. And so many of them end up with a seizure disorder they never had prior to those antibiotics. They end up with, unfortunately, ending up in a wheelchair. And that's been a handful of people, more than one, that have ended up in a wheelchair for years because of the damage done by getting into treatment too aggressively without the prehab phase. So it's something that unfortunately doctors still need to learn, that there has to be some sort of prehab before an aggressive treatment. And that's the piece, unfortunately, I think they didn't do with you, but you stumbled upon on your own, and we're going to get to that part of your journey. So now you talked about you were on oral antibiotics, you did some pulsing, and you changed that over the course of a couple of years. Now, throughout that, it sounds like you were in a little bit better of a place. So you had some symptom relief, but you were still really unwell.
Right.
But as soon as you stopped the antibiotics, everything would come back full force and you get
Correct.
worse. And you go
Correct.
back on the antibiotics, get a little bit better, but never really be in a functioning state of quality of life. But it was just this, again, we called it a merry-go-round, right? We adopted that term early on at Tick Boot Camp. So at what point did you stop and say, this isn't working, something's got to give?
I stopped myself. Intuition, God, I can't do this anymore. And as we know now, or that I know now, Herxheimer reaction would knock me out. I'd faint. I thank God I'm here, because I've fainted because of Herxheimer reactions alone at home. And I remember having one that I was going towards the TV and the TV stand, and the corner was there, and I pushed myself back. And I don't know how long I was out cold. And I remember waking up on the floor, what just happened? And that was all due to Herxheimer reactions. It was aggressive, but then again, your soul, you want to get better, right? So there's the kill that you feel as though, if you feel the Herxheimer reaction, you know you're killing something, so you keep doing it.
So let's explore that, your relationship with yourself, your relationship with the strong women in your life, and your athletic career, right? Because the suck it up culture, the tough love culture, the gal who was always hard on herself, the athlete who always gritted through the injuries and the pain of being an athlete, did not get served well with that mindset and that relationship with her body, because she was just trying to fight through everything rather than listening to her body and maybe walking back the level of treatment that you were receiving, so that you weren't constantly herxing and you weren't herxing to the point where you were fainting.
Yeah, and just to build upon that,
But so let me say, so it really was your relationship with yourself and that suck it up mindset that puts you in that position where you were literally fainting.
I agree 100%, because for me it was literally suck it up. This is what you got to feel. This is what you got to do.
Jasmin, right?
Oh yeah, I was coaching myself. The aggressive, tough love Jasmin. You got this. Stop being weak. You got this. Take it.
Can't love yourself.
And there's a lot of that in my poetry book, because I had to learn what that actually meant.
So in regard to your poetry book, where as soon as it launches, we're going to put the link in the show notes. So if somebody's watching this right now and it's not there, it just simply means it's not out yet. So even if we launch this before the book comes out, we're going to go back as soon as it does and put the link in the show notes. So if somebody's watching, come back, you're going to see it. And once you have a date, let us know, and we'll put the date in the show notes as well, that it's going to drop, so people can go and learn and get touched by your poetry. So
and learn how to love themselves.
Yeah.
Absolutely.
So I do want to just make one comment. It oftentimes seems that we're anti-antibiotic, right? For me, I use antibiotics and I use alternative medicine. And I don't regret the antibiotics. I really don't.
I don't.
So I'm not saying that the antibiotics are a bad tool. I'm just saying that I think they may have been too aggressive too soon for you. And that's part of the assist in our PARM framework, right? But you weren't fully prehabbed yet, I believe, and I'm curious if you agree, to receive the therapeutic benefit of a combination antibiotic therapy. Do you agree with that statement?
100%. Knowing what I know now, reading and all the research I've done on my own, 100%. Prep the body.
Yep.
Absolutely. Open up those pathways. You're about to kill, it's toxins. You're about to kill something and attack something in your body. It's going to fight back. There's something happening, obviously, right? And that's the smart way, I would say.
Yeah.
If knowing what I know now and how the body works, absolutely. If anything, I would have said, don't give me the antibiotics. Again, we know this now.
Yeah.
But if I knew what I knew, I would have never that would not have been my first approach to someone coming in with chronic Lyme disease.
What would have been your first approach? In hindsight, what would you have done instead of the antibiotics when you got diagnosed?
I would say the prepping, what you guys are explaining, is great to start off with. Also, that to explain the Lyme journey, explain what it actually means and what we could be facing, because of the lack of not explaining, I think that's why we feel so alone. We're experiencing all these things for the first time. It's so alien. It was alien to me, right? So you feel alone. And unless you have a family member, who are you going to talk to about all these symptoms that are just coming up and how many doctors you're seeing that, I'm sorry that in the beginning, they make you feel like you're a hypochondriac. I know I'm not a hypochondriac. I know I'm not crazy. You know what I mean?
I do.
So I feel all of this, so then you feel like it's you.
Yeah, you can't help but doubt.
You can't even trust yourself. So let alone you're not trusting a doctor anymore. You don't trust what you feel because you're questioning what I feel, but I'm expressing what I feel. But you're telling me that's not what I feel because my blood work is normal, because my MRI is normal. And you're doing the same blood work over and over and over again, but I'm normal on paper. But I am telling you and expressing. At one point, I was begging. That's the truth. And telling them, there is something. This is it. And I'm bringing the symptoms painted out, drawn out with dates and everything. Just listen. And if you don't know, that is okay. Then is there someone else? Can you refer me to someone else? But it's like, no, you have this or possibly this. Here's your prescription. That was the beginning journey.
But Jasmin, you did drive the bus because you're telling me that after a couple of years of antibiotics and getting in this merry-go-round of the antibiotic cycle, you said enough is enough. And you went and said, I'm doing something different. So you made that call. So you were listening to your body, maybe not as quickly as you'd have liked in the past. But when you did make that call, what happened next? Did you go back to this doctor in New York City or did you find another doctor to go treat with?
I went to many doctors, but I stuck with the holistic approach for a while. I didn't. It was also the up and down, even with the holistic approach. So analyzing the whole thing, that's when I realized for myself, it's gonna take a lot, right? It's gonna take, if need be, antibiotics, if need be, the holistic approach, and all the other tools. The writing and the painting and everything. That's the journey. That's been my journey, right? I can't speak for everyone, but and I say that because currently I am not better, right? To be completely transparent, a week ago on Monday, I was in the hospital. But then again, I'm here walking and talking, and you wouldn't even tell that I was in a hospital a week ago on morphine.
But you drove 2.5 hours today to come here to be a part of this experience with your friend.
Correct.
So that just shows how resilient you are to within a week get yourself here. So I understand that you're not where you want to be, but the strength to be in a hospital a week ago and now be here today doing something new and scary and sharing your story to help other people in this community, to me is proof positive that you've made a lot of progress in your journey.
I personally just don't want anybody to give up.
Yeah.
And I don't want people to feel alone. And ask for help. You're not weak. That's a lie. For me, Nicole is that person. Find your person that you can walk this journey with, that you can cheer each other, you know?
Yeah.
It isn't easy. But your family may not understand you because they're not walking through it. They're not going through it. A doctor may not understand you, but someone out there will understand you, you know? And I think that's why, personally, I don't like social media. I don't like being on the spotlight. But the poetry book for me, I would say, wasn't only for me. It's for those who have felt alone, that have also got hit by the truck of past traumas, I would say, and everything mixes up at one point. You don't know if I got to heal emotionally and physically, right? Because I would say I'm pretty self-aware. And being self-aware and then not loving myself at one point, I was able to say, you don't love yourself. Like, give yourself that rest and that grace, because we can be each other's. I can be your cheerleader. I can be your best friend. But can we be our own best friend? Can we be our own cheerleader? When no one's there to pick you up or to give you that positive word, can you give yourself that positive word? So I had to put that into play and into practice.
So let's clean up some language. You were correct in cleaning up Matt's language when he said sick versus unwell. But I think we have to hit the tennis ball back to the other side of the court, which is better versus resolving symptoms, right? Because this goal of being better, or not being unwell, really is I think language that we need to be careful with, because the goal is to resolve our symptoms, to be symptom free, right? We don't have to get all the bugs out of our system. We don't have to get rid of all the negative thoughts. We don't have to, what we have to do is we have to identify the symptoms that are causing us to feel the way we are, and then resolving those symptoms, and not thinking, oh, because I have a symptom and I had to go to the hospital last week, I'm now unwell. No, what we do is we deal with the symptoms as they surface. We resolve the symptoms as they resolve, and recognize that that's going to be our journey for the rest of our lives, whether we have Lyme disease or not. I'm old. I have symptoms. I deal with the symptoms that come along with being old, even though I don't have Lyme disease. So let's make sure we're having these mindset shifts, so that we have reasonable expectations, and we're not now putting ourselves in a position where we're struggling with an identity piece, which I want to explore with you, because you were kind enough to share another one of your poems with us, and you brought up the identity piece, right? So Matt and I did a video recently about identity, and we argue that there are 3 different identities. You can have your identity, which is what God created you to be. You can have a lie identity, which is believing all the things that people told you you were not, or you were not capable of doing. And then we have the my identity, and the my identity is your response to the lie identity, where you're creating this false image of who you are. Largely, we see this on social media in response to the lies, but it's still a false identity. It's not who God created you to be. So one of the things that I was hearing you share as you were sharing this journey with Matt was that you are leaning into your identity. You were believing these past traumas. You were believing these past limitations that were placed on you. You were believing the lie because you didn't feel well enough to have an emotional immune system that would allow you to not believe those lies. And then what happens when we have that identity, we believe that, again, we have all kinds of false beliefs that are constantly being thrown at us. I mean, you could be sitting in a sandbox and some kid looks over at you and says, "Oh, you're stupid," or somebody can look at you like, "You're a bad athlete," or whatever it happens to be, right? And our brain is picking all these things up. Every experience we have is recorded in our brain, and when we have a healthy emotional immune system, it doesn't affect us. But when we get sick and we don't feel well, and not only does our physical immune system break down, but our emotional immune system breaks down, we have one of two responses. We either just sit in believing all the lies, the lie that we can't get unwell, the lie that we can't resolve our symptoms, the lie that if we have a symptom, we are unwell and we can't consider ourselves unwell and do the things we need to serve, or we respond to that by creating a my identity. We're on social media. Look how great I am, and look how beautiful I am, and look at the things that I'm doing. And in many cases, Matt and I have observed, we see these people who are not particularly in a good place going out and getting liquored up with the boys and the girls, and we know the crash is coming, right? Because what you're doing is you're responding to the lie by creating the my identity, and not really leaning into your identity. So give me your thoughts on that breakdown in your journey, and what lies were you believing, and what my identity did you create around that, rather than being the true essence of who you are?
That is a deep question.
We're here only for deep conversation, Jasmin.
I'm
especially with my poet friend.
The my identity. Wow. Give me an example. I just
going on social media and showing everybody how wonderful your life is, even though you're not in a good place. And we've had people, for example, who are just really, really sick, like unbelievably sick, and they, in the whole Spoonie analysis of having maybe an hour of energy a day. And what are they doing during that hour of energy? Are they doing research? Are they leaning into who they are and serving other people? Are they trying to find ways of resolving their lack of wellness? Or are they getting on makeup and getting dressed up and putting on the camera and saying, "Hey, everybody, Jasmin's wonderful today, and my life is great, and I'm living the dream"? What are you doing with that hour? Are you trying to prove to the world and prove to yourself that you're not all those terrible things that you believed? You're beginning to believe that your immune system had protected you from all during the course of your past traumas? Or are you creating the lie?
Yeah, my observation, knowing you for a month and following you on social media for a month, is you are one of the rare people who does not have my identity. You are not putting on a face today. So for at least the last month I've known you, Jasmin, I don't believe that to be you. However, from this conversation, I do believe there are some lie identities that may be brought up already, and Rich hinted at some of those. So maybe that's a little prompt for you to tell us what you think about that.
I agree 100%, and I think that's why I was trying to track my brain with that. Just because I'm not a social media person, and I'm pretty expressive, but that was the beginning of my journey, and it was because I didn't want to accept it myself. I wasn't on social media going like this, but I was at work, masking my pain, putting on, as I say in one of my poems, the red lipstick and the high stiletto heels. That was my identity. It was, I'm not going to tell you how sick I feel and how I just got out of the bathroom crying, and how I have to just wipe off the tears, pat myself back up, get out and be my coach, right? And go do a site inspection and perform. At one point, there was a mask and there was a performance. And the performance was, I'm not sick. I don't have pain right now. That was who I was.
Yeah.
And Jasmin, you wouldn't have needed those three beautiful women to fly into Puerto Rico and find the 80-pound Jasmin who was pouring herself out of bed and using the wall as a crutch. And I didn't want to say that, but when you were asking me the question, I was giving you a social media example, but it's only the social media example if you weren't living the identity. Because the three closest women in your life didn't know you were in the state that you were in. They didn't know that they needed to drag your butt back to New York. They didn't know that because you will live in the identity.
Yeah. Putting on a fake front, right? And you just described it very well, where you're just putting on this well front, as you noted earlier, right? You were unwell, but you were putting on this well front. But your family eventually found out and came and took you back, right? Now, circling back to your treatment post antibiotics, you mentioned you did a lot of natural medicine and alternative medicine in the assist category, where you're assisting your immune system in killing off the microbes, right? That could be mycotoxins. It could be mold exposure. It could be purging through binders. It could be killing Lyme bacteria or assisting your immune system in killing off that Lyme bacteria. What did you find in your experience were effective tools at eradicating some of the pathogens that brought you symptom relief?
Personally, I would say the detoxing. Besides detoxing, I couldn't pinpoint what has helped.
Can I ask a follow-up to that?
Yes.
Oh, go ahead. I'm sorry. I
No,
interrupted you.
that's fine.
Yeah, I'm just thinking that most likely you were doing an antimicrobial or something to assist, and you weren't feeling better from a symptom standpoint because you weren't getting rid of the die-off. Whereas I think the binders and the detox allowed you to pull the bad things out that were killed off out of your body. So maybe it's hard to assess what actually was helping kill or assist because you weren't feeling any better, because these dead things were floating around in your body, in your tissues, in your blood, but the binders were needed to help pull them out and flush them out of your system.
Correct.
So binders were the key for you.
The detoxing, the binding, the sauna, that which I'm still doing and hoping, right? Because, again, I'm not feeling 100% better now, but I feel as though those tools have helped me more than, for example, an ozone. I didn't do well on ozone. And we also, and again, the timing, I get that. 'Cause some people, for example, when I listen to Tick Bootcamp, I'm listening to what has helped other people that I haven't done, right? So, and I would like to try those things that I haven't done. That's where I'm at right now. What hasn't helped? But what I've been able to notice that has helped is the sauna, is the detoxing, is the poetry, is also the spiritual part. And on top of that, not seeing myself weak anymore. And now it's a complete different identity. It's like, you are strong. You've been dealing with this for 12 years, and you're
That's
still
not an identity. That's identity.
that now it's like you keep it moving.
No,
you know,
that's
get
who
up.
you are. That's your essence.
We're getting through
Jasmin,
this.
that's identity.
Yeah.
And there are times I'll give myself the pity party still, but I don't allow it. No. Like, I call it the grace period, right? Like, yeah, it sucks. That period, it sucks. I'm not going to make it fluff this up. This journey sucks. You feel alone at times. You don't even recognize your own self, right? Your identity gets hazy.
Your confidence goes away.
Oh, absolutely.
Let's talk about confidence for a second, because you did discuss it earlier, right? So one of the things that I learned that I didn't know is what confidence means, right? I was studying confidence, and as it turns out, well, of course, what confidence means is trust yourself, right? But confidence really is not something that can be measured. So it's not really real. It's just a description of a lack of trust in yourself, which you described so beautifully. But for our listeners, really what confidence means is competence, right? And you either trust that you have competence or you don't have competence, right? Do you have the ability to help yourself? Do you not have the ability to help yourself? And one of the things that, and I appreciate you mentioning how you're using Tick Bootcamp, and that is you're listening for other tools that other people have used to make yourself more competent. And when you're more competent, you feel more comfortable in trusting yourself, and you have more confidence, right? And that's that journey to confidence. But one of the things I also certainly want to emphasize with folks who are listening to this, and for you while we're having this conversation, is we don't want you to just listen for new tools, we also want you to listen to the new tools in context. The reason we go through the whole journey with folks is we want to show not only that there are tools that you should try, but you should understand that there are tools that should be tried at different times in the journey, right? The other thing that we're doing and we're trying to teach folks is that it really is a 4-step process that we've seen with this PARM, with the rehabilitation assist, rehabilitation, and then maintenance, right? And you're at a phase right now where you're still going through the assist phase, and that's okay. It takes the time that it takes, and then you'll get to the point where you're going through. You're going to go through the rehab phase where you're not just going to rehab yourself or rehabilitate yourself physically. You're also going to rehabilitate yourself emotionally with different tools that we're going to talk about, and ultimately you're going to rehabilitate yourself spiritually, right? But you have to. I think where people have to show themselves grace or be gentle with themselves is understand it is a process. And it's not going to happen overnight. And the symptoms are there's going to be an ebb and flow of symptoms. And there is going to be migrating symptoms. It's the nature of Lyme disease. And you're going to have your arm feeling good today and your leg is going to feel bad tomorrow. And that's going to be a part of this journey, right? So that's really what we're talking about when we're talking about, the confidence piece, which is really competence. And once you have competence in not only knowing what new tools you may want to try, but what order you should try them in, generally you'll find yourself in a good place.
Yeah, and I think there's overlap there for you as well, Jasmin, right? And in our framework, because Rich and I debate this all the time, where we say prehab can carry forward to assist, because some of those tools they're great along all 4 phases, and they have to. But I think although you might be in the assist for some things still, you're also in the recovery for some things too. So, for example, you did a lot of gut damage with antibiotics, right? And now you're working on repairing your gut. So if you're repairing your gut, that's part of the rehab. You're rehabbing the damage that was done to your gut from the antibiotics while also working on assisting the immune system in killing some of the pathogens at the same time. So it's not black and white, but this is a general sequence. And that's why it's important to understand, like, where am I and does this fit where I am now? And if you understand that framework Rich described, I think you can plug these things in from our podcast into where you are in your journey.
And another one of the lessons that we learned, Jasmin, from Rachel Leland and Dorothy Leland, the president of LymeDisease.org, is that Rachel continued to be symptomatic even though she no longer had bugs in her. And the reason she was symptomatic is because she needed neural retraining. And it was actually the neural retraining that remove the symptoms. So in some cases, what we're doing is our body is giving us this ebb and flow because of the change in our neurology, even though it's not a physical bug that's causing us to be sick. It's actually the changes in our neural pathways that are causing us to be emotionally respond. So in some cases, we have to stop the assist phase and move into the rehab phase where we're going through the neural retraining piece, which may be the next step in your journey. So I'm sharing that with you because I want you to just pray on it and see if that speaks to you. And you may want to listen to the interview we did with Dorothy and Rachel Leland to see whether or not maybe you need to be in the rehab phase now, and that would be the neural retraining piece.
It does make sense. It does, and I'll definitely be looking into that episode.
And I got to give a shout out to my favorite interview we ever did on that, Primal Trust. So Dr. Kathleen King, who created that program, has been my absolute favorite person in that space. There's plenty of them, but she's just one who has a really good online community for brain retraining and, essentially the neural pathways retraining. And there's some really good science behind it. So there's an interview out there we did as well, if you haven't already listened to, for you and everybody else listening to this podcast. But so we talked about the detox, right, as being a key piece. But I just want to ask you a little bit deeper because you talked about, okay, I'm going in the sauna, right, and I'm taking some binders, I'm taking some herbs. But I want to ask you to be more specific. So for me this morning, before I came here to do these interviews, I got up and I went to the gym. I did a little bit of cardio to get my body moving to help with my detox. And then afterwards, I took chlorella, which Rich can't take because he has a gut infection, in case you were wondering. If you listen to the podcast before, you know it's a joke. And, in addition to that, I love to then counter that with like a fruit smoothie. So I'll do some protein powder, I'll do some strawberry, some blueberry, some banana, whatever I have, and do that. And when I do that, I feel amazing for the rest of the day because I'm helping my body purge toxins by sweating. I'm getting my body moving. I'm having the chlorella help purge things out and facilitate the removal of things. And then the fruit smoothie is great from a fiber standpoint and also a detoxing standpoint. That's a simple thing I do, and I do it on a regular basis. So can you give me something similar that you found that helps you from a detox standpoint?
Every day looks different for me. It depends on how my body is that day, and that's how I attack the day. Unfortunately, and I've tried this before, and because it wasn't successful, the morning routine and having it, the exercise, the prayer, what is it? Just a list of things, right? So I would wake up in the morning with, I have to stick, this is my morning routine, I have to stick to it. But when my body wasn't feeling up to it, I would be hard on myself because it was like I failed my morning routine. And I had to get out of that cycle too. And when I realized that, now, today, it depends on how I wake up. And I listen to my body. And if I'm not up to it, then I'm going to take my morning very slow. I'm going to have some breakfast. I'm going to have my supplements. I'm going to get in the sauna, put my headphones on with a meditation. That would be a normal, you know what I mean?
I do.
And if I wake up and, symptoms are about 20% less, I can do a little more today, then I'm adding to that morning routine. Doing more, meaning go for a walk, meaning go jog, grab some 2-pound dumbbells, because I used to weight lift. So it also changed my body composition, which I wish I can lift some weights. But hey, there's stretching. Hey, there's Pilates. So if it's a better day, it adds all of that, the sauna, the supplements, the smoothie, the good breakfast, the meditation. And if it doesn't, it's okay. And that's how I communicate with that and give yourself that grace, as you said. Like,
and not see yourself as weak.
Exactly.
Right.
That's beautiful.
It is. But before Rich talks to you about what's next in your journey and your experience and in life, I just want to challenge you again, because there's been a subtle tone for this entire discussion that you feel like you are not as far as you are. And I'll tell you, as an observer, I can tell you with 100% confidence that you are further along than you think you are. You described that you literally were using the walls to navigate around by yourself and crawling around, 80 pounds, couldn't eat. And here you are today. So I really want to challenge you to reflect back on where you were and where you are today. I understand there might be days where you're stuck in bed still. Mm-hmm. However, in general, you're here right now, right? The fact that you're here is such a powerful testament to your health.
Processing at such a high level.
Yeah, and your cognitive abilities are so great right now. So you really need to be more kind to yourself and try to reflect on what Rich was talking to you about, where what beliefs you have that are still identities, not part of your identity. Because I think you really need to reflect on that, and you've come a lot further than you think. So please just digest that a bit.
It's nice to hear, because when the physical doesn't match, it's hard to get into that mindset.
Yep.
Honestly. And simple as this, all or nothing attitude, and I have to work on that still.
Yeah.
It's as simple as that.
Yeah,
I was an all or nothing girl.
Jasmine's hard on herself, and that's part of the relationship piece that we were talking about, and that's okay. One of the really cool things about having a conversation like this is it helps us to identify those kinds of things that we need to focus on that we don't always understand when we're just in our own head, or we're just around people who we're familiar with and who are just loving us and aren't going to challenge us the way Matt and Rich are going to challenge you, right? So, I want to talk to you about two other things before we wound down, and the first is you're a writer, right? Mm-hmm. And one of the things that we like to encourage people to do is to write down what is happening on their journey. Mm-hmm. And the reason we encourage people to do that is because we get to a point where we've had a lot of progress, but we're just living our lives and we are where we are, and we don't really have the opportunity to reflect back on what had happened earlier. So one of the virtues of journaling is it helps you to see that you've made progress, because you can look back to the Jasmin who was pouring herself out of her bed and and using the wall to to hold herself up, and see how far Jasmin has come, right? And had because you are a writer, and because you've written so much of that down, and again you have articulated that here, which will be here for you forever. You can look back at that and say, holy cow, I'm not in a great place today, but I'm not the gal who was 80 pounds pouring herself out of the bed, right? I'm not exactly where I want to be today, but I'm not the gal who has to hold on to the wall in order to be able to do that. I'm not exactly where I want to be, but I was in the car for 2.5 hours driving from Staten Island to come here to Long Island, and I'm not only doing an interview, I'm participating in an interview that I'm really being challenged and I'm processing at a very high level, right? That contrast is something that as a writer, you have the ability to capture and help yourself move forward with that. So give me your thoughts on journaling and how the journaling can be used in a very healthy way to help you see the progress that you're making.
Me without writing is not me. It's helped me so much. The journaling, I pour out my feelings. If you cannot afford a therapist, that is it right there. That's how I see it. That's how I pour out. And I can be so honest with you, Rich, when I pour that out and when I write it, I left it there and it's
another type of detox.
It literally is. They're there. The emotions are there. There's again, the poetry collection, there is a lot of raw. It was written a lot of it while I was bedridden. So there's a lot of the raw, I hate this state of being. And I also write, and towards the end, the last chapter is called Poetic Healing. And it talks about how writing has healed me, and it continuously it's healing me till this day, pouring it out. That's my therapist. Poetry is my therapy. Writing is my therapy. To make it a perfect example, I had mentioned I was in a hospital on Monday. On Monday, the first thing I put in my bag, didn't know how long I was going to be there, was a notebook and a pen. First thing. While in the past, when I didn't do that, you're paying attention to everything going wrong with you and your surroundings. I'm in a hospital, again, probably the 1,500th visit, right? I didn't think about that. I was just writing poetry, and there it was. And time went by like this. I was in excruciating pain to the point that the doctor said, how, from a 1 to a 10, I said 20. Because physically, we've dealt with so much physical pain, it kind of becomes a norm, unfortunately. But I don't panic anymore because you felt it before. You recognize it. So being at, again, Monday, I'm just writing. Doctors are pinching me, blew out a vein. Once she stopped, I'm writing. And I left it there. And everything around me was fine. And, okay, you can be discharged. Thank you. That's how
but the
time
reason,
went.
and we need to explore this in some detail. The reason everything was okay is because Jasmin was in her essence. Meaning, if Rich went into the hospital, I wouldn't take a pad and I wouldn't take a pen with me because Rich is not.
So true.
God hasn't made Rich to be a poet. God hasn't made Rich to be a writer, and that's not what God would have Rich take with him. But Jasmin was made to be a writer. When Jasmin heard the very powerful Pulitzer winning poet Maya Angelou, her spirit spoke to her, and she said, "This is who you are." Jasmin then began this journey at 12 years old where she was writing on a regular basis because that's what God made her to do. That's how she was going to serve the world and help other people see healing in her writing. And then Jasmin got away from who she was. She poured into a boy rather than into herself. She stepped away from the things that she was supposed to be doing. And because she stepped away from the things she was supposed to be doing, her illness took off. And she got sicker and sicker and sicker because she wasn't living in her identity. She was living a my-identity. Or she was not just believing the lies, but she was also living the life that wasn't the life that God had created for her. And then when Jasmin got sick, she was given an opportunity to reignite her identity and to find herself, and she started writing again, and she started being a poet again, and she started serving the world the way God created her to serve the world. And now what you're doing is you're now publishing that so other people can see their feelings and understand their feelings from the way you're expressing them in the unique way that God created you to do that, right? So you found your identity. You found what you were made to do, and now you're doing that. And once you do that, that's how we get onto our healing journey. So The model that you're outlining for people is not everybody bring a pen and paper with them, but that people go back to the place where they understand who they are, right? Because what the research shows is there's 3 ways of finding your identity. And this is the work of a professor named Anthony Burrow from Cornell University. So the first way we find our identity is that we watch other people in their essence. And then we reflect on how we can model that in our own way. Because every one of us is unique and special. There was never a Jasmin before. There is no other Jasmin, and there never will be another Jasmin, right? But that doesn't mean that other people watching this and listening to this can't see the rich in Jasmin and how I can find my essence by watching you. So one way we do that is by watching other people. Another way of doing of finding our essence is going through a traumatic experience. And I know this is triggering for a lot of people in the Lyme community when I say to them, everyone we've interviewed has said they wouldn't give the journey back. And the reason they wouldn't give it back is because it allowed them to find their essence. Right? It allowed them to find who they were or get back to who they were because they got away from who their essence was, which is why this has been such a cool podcast, because everyone can now watch Jasmin go from who Jasmin was, Jasmin get away from who Jasmin was, and now how Jasmin came back to being who Jasmin is, right? Because you're now in your essence and you're now doing what God created you to do. And now you're serving everybody by publishing this, and you're serving everyone by doing podcasts and sharing your poetry, right? So the first way that we find our essence from the work of Professor Burrows is by modeling other people. Another way we do it is by having a traumatic experience that strips it all away from us and puts us back to where we were. And the third way that we find it, which has also been a beautiful way you've described this, without knowing it, is that we go back to what we enjoyed doing as children, what hobbies we had, what experiences we had, and that gives us clues into who we really are in our essence, right? So I think what's been really powerful about this podcast here, certainly from the standpoint of the identity piece of this and how important it is to recognize what an identity is, recognize what an identity is, and ultimately understand that in order to be able to heal, you have to find your identity, is that you modeled how it happens, right? The first way it happened for you is you realized that you were, as a young person, a poet. You watched other people pursuing their identities and you understood that it was a poet. And then you had this traumatic experience that stripped it away and you found the poet. And that's why you are prescribing your poetry as your medication, because that's how God made you. And every one of us has it. It's not poetry for everyone, it is for Jasmin, but everyone has it. And that's why I know you're going to be no longer unwell, because you're on this place where you found who you are, and everything else is going to build out below that. So give me your thoughts on that, Jasmin.
That was beautiful. And I agree with that. I agree with that 100%. If it isn't, again, and you said it, if it isn't writing, if it isn't poetry, you have something. We're not here for no reason. You weren't created or knitted in your mother's womb for no reason.
Or without skills.
Correct. Everyone has something. Everyone has a purpose. It's finding that. And also, I would say surrendering to the unknown, because it is a scary thing. We're, I would say, molded to have control, to say, hey, high school, after high school, college, after college, work, after work, family, marriage, children. But what if that's not what, I had to grieve all those things. So besides the self and the health, the marriage, I'm going to be 40 years old. I do not have children. Did I want to be a mother? Yes. Did I have to grieve that? Yes. Am I okay with that today? 100%. Because I've surrendered. I don't have control over that, right? And I'm okay with that now. Now I don't see myself, oh, you don't have any children. That's so, I lost something, an experience. Now it's not I lost. Now it's, honestly, I surrendered it. I did grieve it, but I'm so okay with it now that I can say it out loud without crying. Because at one point I couldn't talk about children. I couldn't talk about marriage. I couldn't.
Well, Jasmin, I'm going to ask you to be more gentle toward Jasmin. And we're going to expand on this during a future conversation because I want to stay focused on the identity piece with you, right? Because one of the reasons why we often don't see our essence, we don't find our identity, is because we think we can control everything. And the reason we want to control everything is because we think that makes us safe. But it's actually just the opposite. Because we can't control anything, but we try to persuade ourselves that we can control everything, we make ourselves vulnerable because we're living in a lie. And we're living in a lie, then we find ourselves in a place where we're not living in our essence and we're not living the way that we should be living, because we're going to be happy when we're doing what we were created to do. And for you, it's to serve the world by being a poet, by sharing the way that you've detoxified and sharing the feelings that I couldn't express certainly in writing and in a rhythmic way, because that's not the way God has made me. And that's what you are been born to do, and that's how you're supposed to serve. And whether those other pieces that you've grieved that I'd urge you not to revisit will ultimately be available to you when you're living your essence.
It's a nice way to put it, Rich.
So we really appreciate you coming here and sharing this very vulnerable story with us and helping us to teach people about identity and the importance of their identity, teaching people what confidence and competence is so that people can show themselves grace. And I really appreciate you sharing with us how hard you were on yourself, what impact that has had on your healing journey. So Jasmin, you are a beautiful person who has done a really, really great job of sharing this story with everyone. And I'm really glad that the Spirit has brought you here so that you can help all the people you're going to help through them listening to the story and watching the story on YouTube.
Thank you, Rich. It was great being here. You guys are awesome, by the way.
Sure.
I have to say.
This is awesome because you were awesome. That's why.
You guys are awesome. You're like family now. What can I say?
Well, we have the Lyme mom here, so we're all.
Yeah.
Where's
we're
mom?
all-
There she
Can
is.
I have Lyme sister or something?
Yep.
Can I have a name?
we have
Lyme poet? I don't know.
the Lyme poet.